Well, good morning, everyone. It is 9:30 and we are going to get started. I wanted to welcome everybody to today's event. My name is Christina Mccoy and I'm a Community Partnerships Manager with mHealth Fairview. I have the privilege of being the co-chair for our policy committee of the Eastside Health and Wellbeing Collaborative, which is one of the partners that came together today to make today's training possible. So today's training is really a collaboration among a few community partners. First, the Eastside Health and Wellbeing Collaborative, which is a community-based collaboration designed to improve the health and well-being of residents on the east side of St. Paul. Also, we partnered with mHealth Fairview's Interfaith Health Collaborative, which seeks to improve community health and well-being through the intersection of faith and health, interfaith collaboration, and outreach. And last, but certainly not least, our third partner organization, where two of today's presenters are from, the Network for Public Health Law. The Network for Public Health Law is a national organization providing leadership and technical assistance, training, and leadership to help empower public health agencies and their partners to understand how to use law policy to improve community health and equity. So I want to thank you all for attending today. And at this time, I would like to introduce one of our cultural brokers, Ms. June Blue, who will open us up with a blessing and get us started for the day. With that, I'll turn it over to you, June.
Bonjour. I'm going to introduce myself in my native language, as is protocol. I wanted to thank Christina and Sarah for hosting this amazing, wonderful meeting. So, Buju Nindawe Ma Gani Duk Benesia Kwe Indigo, June Blue Indigenous Cause, Ajajak and Dudame, Gawaba Bagana Cognin Dunjaba, Anishinaabe Nokome Sokichida Kwe. So, hello, my relatives. I greet you in a good way. I wish you Mino Bima Dizawin. I wish you all the good life. I am a grandmother. I'm from White Earth Nation. I have 7 grandchildren. I'm Crane Clan, and I'm a 3rd generation veteran. It's a great honor to be here. So I have this smudge bowl, and in this bowl, I put some sage in there. Sage is what we use to relieve any negativity or take away any negativity.
Every morning I have to go turn it down.
And
yeah,
I also have
in here in a little bit.
Sweetgrass on here.
Hey, Andy, we can hear you.
Oh.
Somebody that matters, somebody strategic to us will get a job.
Can you mute him?
Yeah.
Yep.
Yes, I'm working to mute folks.
I mean, we're good. We're good
okay.
thus far.
List to bring back when we start up.
Yeah. No.
That was not hurtful to that, but eventually.
Oh, yeah.
So we're having a little bit of background noise. So if everybody could just ensure that their microphones are turned off.
We go, the longer. I mean, the more
Andy,
I hear,
we can hear you.
people are looking and they've got to be and all that stuff. So we'll probably.
Andy, we can hear you. Please mute yourself.
Okay. Thank you. I'll just continue. Thank you. I'm just going to, again, talk about the sacred medicines in here. We have 4 sacred medicines: sage, which reduces negativity and takes away any negativity. I also have sweetgrass. When we put sweetgrass on the fire, it brings good things to us. So I'm asking Creator to bring good things to us. I put cedar on the fire. Cedar is another sacred medicine. We use that for healing and for protection. And then the last medicine that I have is tobacco. I have this tobacco in my hand, and then I'm just going to pray with this tobacco and say, Giji Manadu, I please ask you with all humility, Jawena Mishanam, to have pity on humanity right now and to have pity on all of us. We are just human beings, and we're trying to take this journey together. And I wanted to mention, I have this medicine wheel, and this medicine wheel has been in the Anishinaabe culture for thousands of years. So we knew that there were 4 races of men. And the 4 races is the Asian race, which sits in the eastern direction. The indigenous of North and South America that sits in the southern direction, our Black brothers and our relatives that sit in the western direction, and then our white relatives that sit in the northern direction. And as you can see, that they're all equal. There is not one more color that is more than the other color. So I'm asking us, and I'm asking Creator to give us strength to take this journey together, and that we all listen to each other's viewpoints with greatest honor and respect, and we tell our truth also. So I say, Miigwech, Creator, thank you everybody for being here, and I'm very honored to be asked to do this blessing. Miigwech.
Thank you so much, June, for helping to ground us and kick us off for today's event. I should note that June is one of 5 cultural brokers within mHealth Fairview that is deployed within 5 community organizations serving 5 different cultural communities. Again, June, thank you so much for taking the time to be with us today. And at this time, I'd like to turn it over to my Policy Committee co-chair, Sarah Rogers.
Thank you, Christina, and thank you, June, for your beautiful blessing. Welcome, everyone. I am so glad to have you here. Again, my name is Sarah Rogers, and I'm with the Network for Public Health Law and the co-chair of the Eastside Health and Wellbeing Collaborative Policy Committee. I would like to introduce everyone today to one of our presenters and my colleague, Jean Matthews. Jean is the Region Director of the Network's Southeastern Region Office, located at the University of North Carolina, based at UNC Chapel Hill. Jean, thank you for being here with us today. The floor is now yours.
Thank you. I need somebody to let me share screen here. I'm not able to do it yet. So I'm Jean Matthews. When I can get my screen up, here we go. Boom, boom. There we are. Okay. We look good. And presenter view. That's close enough for government work. Speaker view. Okay, I think we're good. Can you hear me okay?
We can.
All right. Okay. Thank you. So I want to thank Sarah for all you've done to make this happen with Christina and Ann Ellison with some amazing coincidences and synergy that have this happen. We're excited to be exploring what, for us on this messaging work we do, is new ground to be working with Faith Health on health equity. So I think you're in for a treat. So you know who I am. I'm Jean Matthews. Thank you, Sarah. Joining me today is my colleague and one fine public health lawyer, Dawn Hunter. She's deputy director for my Southeast region, and the best thing that's happened to me during the year 2020. Prior to joining the network, where she spearheads our health equity legal team, she was also with the New Mexico Department of Health, beginning as an attorney and ended up as the deputy cabinet secretary for the Department of Health with a lot of experience. She is also a thought leader in public health law on health equity, and is great to have you here, Dawn. And then the third person here, similarly a national thought leader in faith-based health, is my good colleague from North Carolina, Gary Gunderson, who, as you see on the screen, holds all these appointments at Wake Forest University and Wake Baptist Medical Center on faith and health. And he's really a national spokesperson in your field of faith-based health. He's been part of our messaging team for, I guess, 6 years now, Gary, in helping us shape this. And prior to being at Wake Forest, he was in Memphis, Tennessee, doing faith-based health. And prior to that, he was at the Carter Center in Atlanta, where the same mentor that I had, Bill Foege, the legendary CDC director, mentored him into public health from his other profession as a Baptist minister. So I want to just quickly, our program today will be I will give a quick snapshot overview of moral foundations theory to give you a tool to gain insight in how to empower communities to change health policy and law in order to improve health equity. Dawn will then give about a 10-minute presentation centering on centering equity in public health messaging and some really interesting tips on making a creative narrative. And then we will all get out of the way and let Gary preach to this group about the long arc of connections between faith communities and public health. So with that, I'm going to move this right on down the trail. This is the slides and PowerPoints will all be available to everyone. It's in the public domain. This is sort of the link to our Becoming Better Messages material. We've got a lot of stuff there, and our website on COVID-19 and health equity, which is a lot of material there as well. And so sort of the goal of what we're trying to do is, and this was the website that you were sort of dumped off to for those of you that took that Moral Foundations self-profile evaluation, which I'll talk to in a minute. Our goal today is just to give you some practical insight and deeper insight in how to become a more trusted and authentic messenger in your communities amid this COVID crisis that we have. So those are the links, and our materials will be available for everyone. Let me go right on to this slide, which was created by 45 of you who took that Moral Foundation self-assessment questionnaire. You got your individual scores, nobody knows that, but this is an aggregate, and this is very remarkable information. I've not seen a group score that high on these loyalty, authority, and sanctity that we've done in the public health community. They're usually high over here and low over there. I'll explain more about this in a minute, but this is really a remarkable profile that helps a lot. And you did not get your immortal soul judged when you took the test, so don't worry. This was something to introduce you to the material. We will come back to it in just a minute. Now, the other question that needs to be asked is why are two lawyers and a pastor, why are the two lawyers on the screen talking to you about messaging? Are we in a 12-step program, escaping law, or what? No. What we're doing is, this is a framework we use in our public health law world for how we change law and policy using interdisciplinary collaborations and advocacy. And we realize if you don't have good messaging, you're wasting your time in picking the solution, legal policy solution to solve the problem, in developing the advocacy and engaging the communities and building the political will to get the law or policy change done. And it's never going to be implemented or enforced or have any effect if you don't have good messaging to sell it as well. So this is sort of the 5 essential public health law services. There's more of that on our website. Last preliminary here. We need to collaborate and build bridges because we're just in the midst of this perfect storm of chaos created by social media and political polarization. So you can see we've got the COVID pandemic, we've got the economic crisis, we've got structural racism illuminated by COVID. We've got this polarized democracy with a food fight of those on the left and the right, not even listening to anybody. And above it all, we've got climate change, which can drive all of this for the next round that we have to deal with. So let's take just a deep breath, step back, and look at a deeper level to gain some insight of how we become better messengers. So the background of our material came from Jonathan Haidt's book, The Righteous Mind, Why Good People Are Divided by Politics and Religion. And he really is the founder of the field of moral foundations theory. And what he talks about is that we intuitively resonate to foundational moral values, and much of our social and political and religious decisions are driven by our history and our intuitive judgments that we don't necessarily are aware of when we make the decision. So he uses this visual of 10% of what's done is by the direction is by the leaning of the intuitive elephant that we sort of ignore. And then we've got this little person, the rational brain, our frontal lobe up there, thinking it's in control. But most of the time, we feel the instincts that are guiding us. And like lawyers, we rationalize the reason why our religion or our political view or our football team is the best. And it's obviously true because we've got the facts to back it up, where in reality, it's intuitive. So he lays out 6 foundational values, which we find a very useful framework for this deeper conversation. And this is data that he's put together to show it can be replicated with all types of communities and groups and so forth. And so let me just quickly walk you through those 6 values. We could do a whole nother hour on this and do training and how to do skill building activity. But let me just quickly run through them. Number 1 is care and harm. Each of these sort of has a reciprocal on its spectrum. So that's, this is public health. Allison, we could hear you. This is.
I used it on the stove.
Yeah, Anna, somebody needs to mute their mic. This is compassion for the vulnerable and those whose microphones are open. And it's also about intolerance of the suffering of ourselves and other people. We all, as primitive ancestors resonated to that. Similarly, liberty and oppression. We all crave free choices and actions from the time our ancestors moved down onto the Serengeti Plain. And similarly, we are intolerant of bullies. Jane Goodall's research on chimpanzees showed the same thing, that a tribe of chimpanzees that has a bully will eventually drive them out. That's not good for the well-being of the group. Fairness and cheating. Similarly, we want people to be treated fairly. We want to be treated fairly. And we want to get what we feel like we deserve and what we've earned. And we have intolerance for free riders that are just drifting along, not pulling their weight. And they're waiting to get voted off the island, similar to the bullies in Jane Goodall's chimpanzee tribe. Now, the other 3 values, a little more nuance. Loyalty and betrayal, again, is about loyalty and the personal trust that we have for group identity. So we can identify with our family, with our larger family, with our neighborhood, with our region around Minnesota, with our football team, whatever. And in the era of social media, we can shift our loyalty groups with one click of a mouse. Also embedded in that is the social isolation for those that betray. If you cross our group and betray our group, you're done for. We don't need you anymore. And this is intuitive, instinctive, reflexive that sometimes our rational brain doesn't realize we're doing it. 5, authority and subversion. Again, sort of Darwinistic history, there's always been a competitive natural selection benefiting the advantage of organized groups with good leaders. So Alexander the Great his leadership model was not to enslave the next country, but say, come join my big red team. You can be part of us, and we'll go and conquer the next country. And, he, in his day, conquered the known world pretty much. So we like good leaders, and also embedded in that is the intolerance of those who subvert the system. If you're a Marine private in boot camp on Parris Island, you're quickly told, don't buck the system, private, because we have a behavior modification that will instruct you otherwise. And I've been there. And so we don't tolerate those who subvert, and we like to have good leaders, good leadership. A sore point these days, or certainly over the last 4 years, in my humble opinion. And the last item is sanctity and degradation. So Gary can fill this in more, but it's the part of our human spirit that's elevated and pure. Regardless of your religion's origin, you touch it with births and deaths and weddings and, these Kairos moments where time stands still. And we act in an elevated way, not to serve our interests, but to serve the interest of our group. And we have a natural aversion to personal self-degradation. So we could go on about that, but here's the short version. Haidt found that you could measure this and reproduce it everywhere. And he did it in a number of areas, countries, cultures, came back to the U.S. and did it with a U.S. population. And he found the most interesting thing, that there was a significant divergence of the profile, like the profiles you just took, between U.S. political liberals and U.S. political conservatives. So the intuitive, reflexive values of liberals, political liberals in the U.S., they're focused here. They want to help those in need. They want to care for the weak, prevent harm, and are interested in rights and fairness and equity of outcome. So see how high they score over here on these three values of care, liberty, and fairness. Whereas, we libs score a lot lower in most polling on loyalty, authority, and sanctity. Okay? Now, in contrast, the conservatives, they also value helping those in need intuitively, reflexively, but they're also about preserving the norms of treasured institutions. So they score higher on these three values over here on the right-hand side: loyalty, authority, and sanctity. And what Haidt discussed and what triggered our frontal lobe is putting the two together. You get these two different parallel views of intuitions, really, of use of intuitions. And when you poll liberals, they kind of understand that the slope of their curve going across this spectrum is high on the left and low on the right. But liberals tend to misunderstand. If you ask them, they think, yeah, I suppose those conservatives, they're high on loyalty and authority and sanctity, but they don't care about care, liberty, and fairness. Libs misperceive that, okay? And it's illuminating when this is presented. This can be replicated. By contrast, conservatives, clearly they know they score reasonably high over here on care, liberty, and fairness. They also accurately know that liberals misperceive them and think that they don't score high over here on care, liberty, and fairness. That's not one of their true values. That's just manipulation or something to get all the money or whatever conservatives do. And so it gives this conservative advantage because, as Haidt says, conservatives understand all and resonate to all six of these values that are hardwired in our cultural DNA. whereas liberals, political liberals, are only playing with 3 cards in a 6-card deck. How do you get anything done? So we have sort of moved that around to what we're finding in public health, that this also gives us insight into what we're calling a public health advantage, because as we're seeing in polling, a lot of audiences here in North Carolina and some that we did in Colorado and Wyoming back in a plenary we did in the summer, we're seeing public health people score higher over here, as you just did. And so if I can just back this up for a second, let's look at this for a minute. See how high you folks in faith-based health and you pastors scored on truly resonating to loyalty, authority, and sanctity. That's really good news. Bless you for that. You made my day when I pulled that slide up last night for the first time. So we could go down a rabbit hole, but I'm going to get done here. I'm almost at the time. We can do deeper training with audiences on how to take any kind of issue that you're working on and frame it using all 6 of these values. And we're finding it's useful. We started out thinking this was something for leaders and advocates and so forth, but it's also extremely valuable to frontline workers who are jumping across the cultural divide every day, in the greater metropolitan area that would be going, in a inner city one time, and then you're out on the edge of Lake Wobegon in a very conservative, traditional community. And how do you deal with all the spectrums in between? So for public health, we're finding it, and I think this applies to you. It's not just that liberals in public health, which is the way I think most public health people tend to gravitate towards, they get care, social justice, and equity, but they also understand loyalty. The heart of public health is community coalition building. That's what you do. That's what we in public health do. Authority, public health is a police power doctrine preserved under the First Amendment and reserved to the states. As I offhandedly said in one of our preliminary conversations, public health, we're sort of quiet about it. But if push comes to shove and there's a person, if you're about to infect a community, we will quarantine your ass if that's needed. So we do quarantine and food inspection, environmental, et cetera. And then the nobility of public health. While others are running away from the fire, we run towards Ebola or towards COVID, which is what the faith community does. This authority value, not only do we have police power doctrine, you folks in faith health have the authority of faith professionals. You have the respect and you use it, and you were gravitated to it to be called to that. So real quickly, and I'm out of here, community health and civil discourse. Community health has the breadth of moral values and can use them in a way to make people across the political spectrum feel safe and engaged in relationships with us to improve our communities and our community coalition building. And also, civil discourse is vital to community health. You can't build a community coalition unless you've got a civil conversation taking place and people aren't throwing spitballs at each other. So for public health, we need the civil discourse, and for community health, we need civil discourse to occur. And the beautiful thing about this is it goes the other way. Community health can add value to community dialogue. So that's what I've got. And if somebody wants to pull Dawn up, I will stop sharing and she can talk about centering equity in public health messaging. And while it's coming back up, I'm going to share my screen down. I want to remind you that we're taking questions. We're going to reserve 30 minutes at the end of this for a Q&A session based upon your questions. I see some of them are already inserted in the chat box. Go to your chat box, put your question in there, and we'll be able to recognize you. So I am off this, and Dawn or Sarah, take it away.
I am here and I'm ready. I was unmuting myself. So I want to start by saying thank you. Thank you to Sarah and Christina and the East Side Health and Wellbeing Collaborative, and to Jean for the very generous introduction. I'm really excited to be here today. And I'm going to just walk through, what it means to censor equity and share some tips and ideas on how to do that. And let's make sure I can advance my slide. There we go. Okay, so I want to start first with this question, and you'll see me probably have two screens, so I'm looking off to the right a little bit. But what do people want to know versus what we as community and public health professionals want to tell them? So in the bubbles are some comments that I've heard recently. I don't trust how fast this vaccine was developed. People should not be making $15 an hour to work in fast food. Focusing on racial equity doesn't promote unity. The death rate is only 0.2%, so why is everything shutting down? Behind each of these statements is a deeper question and a moral value or values. How do I know that I'll be safe if I get the vaccine? I'm not comfortable talking about race or about racism. I don't think it's fair that some people make more money for the kind of work they do, or maybe it's I deserve to make more money too. Or it's I should be free to make my own choices about my risks. And there are lots of other reasons behind these statements, but I want to encourage you to go beyond what you hear and really get at what do people in the community want to know. So censoring equity means that you're thinking about equity in the content of the message. So for example, that could be a message about hospitalizations and deaths in a community of color. Or you could be thinking about equity in the outcome of a message. And that could be a message about food distribution sites and times in a local neighborhood. Censoring equity is really important to promote equity as an idea and as a goal, and to normalize the conversation, and to reach people where they are. And I also want to encourage you to think about your own reasons for censoring equity. These are just a handful of reasons. So the next few slides are about creating a narrative. And one of the most important things is to know your audience. Studies of social justice movements make clear that movements are not going to happen if you are always and only reaching your advocates and champions. Everyone has a tipping point, every person, every movement has a tipping point. And so your messaging is really about reaching those people who can be tipped. There's a really excellent book called The Tipping Point by Malcolm Gladwell that dives into examples of how movements have started, and including some with a public health perspective. You also want to consider your audience values based on what we just covered, the moral matrix that Jean just went through. And remember that your audience could be 1 or 100 or 100,000. So we also don't talk about things using the same language. So think about what language does your audience use? And the last thing I want to emphasize here on this slide is, what is your purpose in reaching the audience? Do you want to influence their behavior? Do you want to inform some decision-making? Do you just want to educate people? You have to be very clear on that upfront as you develop your messaging. So this is a way that you can visualize your audience using either the collaboration continuum or the stakeholder management model. There are other models out there, but I like these two. Remember that your advocates and champions and those who are leading, they are already going to be responsive to your message and do what is asked. So they don't need the same message as people who are on the fence. And some people are just resistant. You are just never going to reach them. So someone who doesn't think COVID is real is going to be very hard to convince otherwise. You're not trying to message to people in that group necessarily. Or if you are, you're definitely crafting a different message. And so you want to think about creating a tipping point by messaging to people who are neutral, who are curious, who are aware, who are supportive. What does it take to reach that group of people? And I put an asterisk by unaware, because just like the other end of the spectrum, where you have your advocates and champions, the group of people who are unaware need a different message than the people who are in the middle. So going back to identifying the language of your audience, I was talking to someone fairly recently about racial equity and conservatives and liberal positions on this. And he said, white conservatives want racial equity too. And I was like, of course they do. That's what moral foundations theory tells us. We value the same things. So I like this graph because I think messaging often targets the lower left quadrant or the upper right quadrant, but it misses this heterogeneous group of voters in the upper left quadrant. You can see there's blue, there's red, there's yellow, which I think is other or voted for someone else in the 2016 election. So this says, if you're trying to make sense of Florida's vote to raise the minimum wage to $15 an hour and to reelect Trump, I would like to remind you of the upper left-hand quadrant of this chart. Lots of voters are socially conservative and economically liberal. So the point of this slide is really assume that we want the same things and then identify terms that resonate with the values of the group that you're trying to reach. In this case, reaching out to these voters that are in this upper left quadrant, and not just voters, people in the community who share these same values. So when you get started, lead with values. You heard Jean talk about that, and these are the values again here. You also want to connect to history when possible. How did the issue originate? What is the history of the community? One example that I would share is that here in St. Petersburg, Florida, Tropicana Field is where the Tampa Bay Rays baseball team plays. And they are in negotiations to move their stadium or to build a new stadium. And one of the important conversations is, how does this impact the community? Because the original with the site where that field is, actually was a very strong Black community here in St. Petersburg that was raised and made way for the stadium. And so in considering redevelopment, it's really important to consider the history before the stadium was built and what the community that currently surrounds the stadium wants to see happen. You also want to draw a through line to the issue today, connecting the past to the present, and explaining the connection between public health and social issues like housing and transportation. Those connections are not always obvious to people. And then always, always, always focus on solutions over identifying problems. Communities hear a lot about what is challenging for them or what's wrong or what needs to be fixed or where resources need to go. But they also have a lot of assets and strengths, and we want to build on that. So one thing I really want to emphasize is focusing on places or conditions rather than people. This is especially important so as not to reinforce the idea that people that people who are suffering due to COVID are suffering because of poor choices that they made. But their suffering is really actually the result of social and structural barriers to being healthy and staying safe. So one example of what a message like that might look like is instead of saying African Americans in this community have higher rates of diabetes, you might say diabetes is more common in neighborhoods that don't have access to healthy foods. And those neighborhoods are XYZ. So these are a couple of other examples of what that might look like. I don't endorse the statements or other. I just share them because I think they're interesting. And so the one on the left is, I need politicians to stop saying the Black community doesn't trust our vaccine and start saying we have a history of medically abusing Black people, thus we violated their trust. So focusing on the system that created the distrust rather than the actions of the people you're trying to target. And the other example that I like is from the New York Times. The headline is how decades of racist housing policy left neighborhoods sweltering. So it's not that people choose to live in neighborhoods that don't have trees, tree cover, safe streets, et cetera. It's that redlining and racist housing policy concentrated people of color in neighborhoods that are exposed to more environmental hazards and have less green space and get hotter. So that's the issue, because especially if we're talking about law and policy solutions, those are the things that have to change, not people's behavior in those communities. So again, focus on places, conditions, or systems rather than individuals. So I briefly want to talk about storytelling. I only have a couple of minutes left. This is important because people resonate with emotion. They connect over shared experiences and values. And we know that empathetic messages bridge divides. So you want to find ways to connect and build trust. Be curious about your audience and enlist trusted partners and community members and bring in the facts later. So one example I want to share is from Humans of New York. This is a series that just profiles people in the community and tells their stories, lets them tell their story and share pictures about their stories. This is one where a young woman who was in a car accident with her family when she was younger, She lost her father in the accident, and she also lost the use of her hands in terms of playing the piano. And her father was an organ and tissue donor, and they saved the bone from her father after he passed. And later, even though she had multiple surgeries after the accident, she was never able to regain the ability to play the piano until they did some kind of procedure, like with a bone graft or something, using her father's bone, and she was actually able to regain her ability to play the piano. I think this is really powerful because every time I think about now organ and tissue donation, et cetera, I will think of this story and how it impacted this person's life. And I think that we can use storytelling to get across the public health message. So the last few tips I want to say is just be authentic in the way that you speak. Again, use an asset-based perspective, and remember that the messenger is often more important than the message. So always be aware of cognitive biases. So how people respond depends on who's giving the message and how they frame it. And the last thing I really want to emphasize is engagement and purpose and the importance of community. So equity and health, in my opinion, will come from better representation, inclusion, and amplification of community voices and perspectives in the democratic process. Belonging to a community builds social capital, and we have to leverage that capital to engage in what I heard recently described as healthy political discipleship. And I take that to mean that we need to speak up and speak out about how our community, about how the faith community connects our values and our mission to social justice. Remember that when people have a strong connection to a group or an ideology or a belief, they behave in ways that reinforce one of the moral values, loyalty. And that can be a really powerful way to create change. So this slide is my last slide, and this is just a summary of ways that you can censor equity in messaging and things to consider as you develop your message. You may use all of these things or some of these things, but hopefully you take them into account as you craft the message. And I look forward to your questions. I'm going to stop sharing so that we can turn it over to Gary. And thanks for your time today.
And while you're shifting over the screens, just a reminder again, chat box and question. I see Carter Hayward has already dropped a mean question on us right off the bat. So thank you, Carter, and we'll be interested in answering that one. I think Dawn covered some of it, but there's a lot more. So go ahead, Gary. This is your time.
Hey, thanks, Don. Thanks, Gene. As you can go ahead and flip to the next slide. So I'm going to have not many words on my slides. I'm very aware that people in Minnesota helped invent public health. And the people of faith in Minnesota helped invent healthcare, helped invent parish nursing, helped invent an extraordinary array of fundamental innovations that result in the health of the community. So I really, I started running a list of things I have learned across probably 20 years of visiting Minneapolis, St. Paul from time to time. And so I'm sort of eager to get to the dialogue and learn more. What I'm going to offer up is some images and some sort of shifting of what I think the subject is. I don't think I have anything to teach you. So please don't, if it starts to sound like I think I'm teaching you, please put something in the chat box and remind me that I'm not. But let's start right off the bat. So when corporations or institutions or governments turn to engage faith structures, they frequently, out of political etiquette, think of congregations as faith-based organizations are, they're really not-for-profit organizations. And they frequently speak to faith communities in the same kind of way that someone who is used to riding a horse might address a zebra. A zebra looks very much like a horse, but it's not a horse. No one's ever tamed a zebra. No one's ever harnessed a zebra. No one has ever lived to tell about trying to ride a zebra. So I think of faith communities as zebras, not-for-profit organizations. They're different. They're fundamentally different social structures. So the other way to think of a zebra is as an example of how hospitals and even public health tends to look at the community and see lots of individuals. This is an individual zebra, and you will note the missing tail. The flip to the next one. This is the way zebras actually live. There really is nothing, there is no such thing as an individual zebra that lives to tell it very long. Notice the zebras in a group all have tails. And that's because zebras are a social species. Humans are a social species. So what I want to suggest to you is when we talk about the relationship between faith communities and health stuff, whether it's a hospital or a public health department, it's important to remember that the vast majority of what we think of as medicine is nothing more or less than the intentional triggering of the immune system of the body. And I think of public health as primarily designed to trigger the social immune system of the social body. In the Old Testament, so I'm a Christian and I call it the Old Testament, it's actually the Testament. The people were referred to as the people, and they never meant the individual. They meant the group, the tribe, the herd. So let's flip to the next. What do we have to work with? This is sort of an org chart in North Carolina. My day job, I'm vice president of a division of faith health at Wake Baptist, a academic medical center. But we were started about the same time as Fairview, and much of the work of faith health is on the other side of the sidewalk from the hospital. And there's a superabundance of assets there. We have lots and lots of people who work for us. We have chaplains. We have different kinds of chaplains. We have a network of counseling centers. And we have some lightly stipended community health workers of different sorts. I love the language Fairview uses for cultural brokers. Many of the people who work for Faith Health could be understood as culture brokers. And up on the far left, you see there are hundreds and hundreds of volunteers. And since we charge for parking, we give it away to clergy. And so the clergy who walk down the hall and sign up for our free parking pass, turns out there are 2,927 clergy. Well, they're not a free parking club. These are actually the agents of health and healing that are the primary nodes in the community that are there to partner with the healthcare system and, of course, with public health. So the greatest challenge when you start really mapping the assets, and again, Minnesota partly invented assets mapping, the challenge that assets mapping presents is the exact opposite of the normal management challenge you think of as how are we going to do a lot with a little. The challenge, once you really begin to see the multiplicity and complexity of the assets, is what do you do first? How can you possibly bring into alignment such an extraordinary array of assets? But many of the assets speak different languages. So one way to hear the teaching that Jean did and Dawn did is these are tools for bringing into alignment a complexity of assets that actually speaks different languages and often doesn't recognize it's on the same team. So let's flip to the next slide. A few years ago, in an ill-advised tennis shot, I managed to do what I've never heard done by any other tennis player in the world. I managed to severely injure myself, landed oddly, and popped the tendon right off my hip bone. And, it's hard to do that in tennis. So I don't advise it. And as I was lying there, Dr. Teresa Cutts, my wife, TC, knew that in my head, I needed to understand what my body was trying to do to heal. And she gave me this amazing book, Job's Body, that I recommend to you. And it taught me about fibroblasts. And I began to understand the just extraordinary way that the body was rushing to heal me before the EMS folks had even put morphine in me and trundled me over to the hospital to get fixed. The body is the healing agent. Faith and values is all about giving us the opportunity to see the assets that then the work of leaders, those of us who are on this call, do the work of activating and aligning the social immune response of the communities that gave birth to the people, the public structures. So if you go back to the very first meeting of the Public Health Department in St. Paul, I guarantee you that meeting was opened in prayer. And I'm certain that there were clergy who were probably on that founding committee that was doing the very first basic work of inventing public health, the social immune response of the people of St. Paul. And they would not have seen any space whatsoever between the parts of the social immune system called faith and the parts of the social immune system called public, and the structures of collaboration and mutual support. That's really the heart of giving the people of St. Paul a shot in hell, even in a pandemic. I suspect that public health department was probably born in some kind of a pandemic. It might have preceded the 1918 one, and I don't actually know when the public health department in St. Paul was formed, but it would have been some triggering community scale catastrophe that brought the people together and created the structures that could respond to that problem. So let's flip to the next. So that's one fibroblast. This is the way fibroblasts actually work. They work together. They come together. They are highly particular. The fibroblasts that congregated around my torn tendon and eventually squirted out the goo that was like epoxy that glued me back together. Interestingly enough, the surgeon who I went to said, "Well, let's give the body a chance to see what kind of healing it can do before I, as a surgeon, go in and try to repair this." And actually, a brilliant surgeon. He had a little cross on his lapel. Gave my body a chance to heal itself, and what the body was using was these fibroblasts. Well, it wasn't just like one mega super smart genius of a fibroblast. It was a congregation of fibroblasts. And I think that's actually what you see in the coalition that's at the root of this call that called together us today. That's a congregation of fibroblasts. And you might think of the individual organizations, 60 plus organizations, as sort of different species of fibroblasts congregating to the points of greatest need in the community. Or you might think of the thousands and thousands of people, humans, who are part of those organizations and part of the congregations, part of the institutions, whether it's healthcare like Fairview or public health. You might think of the tens of thousands of people as individual fibroblasts. But either way, what you're looking at is this notion that the social immune system, those social assets, are common. They're distributed, adaptive, responsive, connectional. They're humble, and they're smart enough to have invented the structures that now populate the institutional ecology. Well, we have to be smart enough to align and strengthen and align in places and partnerships of greatest opportunity. So although we are frequently congregated around some problem, some tragedy, some catastrophe that calls us together, what we do is actually not focus on that problem. We focus on the assets that are relevant to that challenge in the same way that a congregation of fibroblasts might. So let's flip to the next one. There we go. You may notice the picture is behind me. TC's sister, Lisa Lum, did this picture for us. I think of it as the mind of God, and you see this extraordinary flow of energy and lots of different kinds of places of worship. The church that TC went to, growing up with her twin sisters, the one in the middle. But you see there are actually like 250,000 congregations, places of worship in the United States. Every single town, ethnicity, faith, there's no such thing as a human group that doesn't have some place of raising up its most sacred voice. Book I'd written actually for Fortress Press down the street from y'all. Was about the 8 strengths of congregations that are relevant to the health of the community, a book called Deeply Woven Roots. And these congregations are not autonomous from each other. They're linked by all sorts of varieties of connectional tissue, different kinds of theologic, different kinds of language that changes over time. And some of these congregations, yes, are toxic. Anybody who's worked in public health for more than a month has had some sort of an untoward experience with somebody speaking the language of faith that makes it hard for the work of public health to go forward. So very frequently, there's a distance born of friction between public health and faith. But at root, again, I go back and remind you what I said earlier. The structures of public health actually came out typically of the spirit of community that frequently was born out of a religious voice and hope for healing. So let's flip to the next one. So the question is, how do we find common ground? How do we actually work with all the assets? And I think there's one instinct, the way to do this is to go bland and polite and non-offensive, and don't be off-putting, and find the most neutral, unoffensive language you can possibly find and hope that maybe we can get along long enough to do something. I don't think that's strong enough in the context of pandemic. I think we got to go deep and use the deepest assets we can activate. So the moral frameworks theory talks about sanctity. The root of that is sacredness. It actually regards the phenomenon called human community as an expression of a sacred phenomena that is literally awesome. The Psalm 98 speaks of being complex and wonderfully made. I think we pause before what is actually the ultimate wonder of being a human and being a community. Now, interestingly, science never stops unfolding possibilities that we didn't know about. The level of science that Fairview has to work with as a hospital makes almost comically primitive the science that it began with. Public health has a level of science to work with that is unimaginably more advanced than the science that initial founding committee opened in prayer might have had to use. Well, faith is the same thing. Some people speak of faith communities as if our primary job was remembering, but I think the primary job of faith communities is holding open the future with a curiosity about what might be possible for a God who's still not done, who continues to reveal new possibilities, discloses new possibilities. So I think the way we actually come together is to honor, people of faith would say pray, for the fulfillment of the deepest, most generative power that you can find in health and public health and faith and public faith, and be humbled before that mystery. Now, we don't have a whole ton. I had originally written 2 prayers, one primarily especially for clergy, or people who are paid to be religious. And, in the Bible, in general, the Bible, especially Jesus, shows very little respect for people who are paid to be religious. But I wrote a prayer for them, and we'll make that available afterwards. But I want you to sort of go into and pause with me in a spirit of prayer for a prayer I wrote for our friends who work in the health of the public. So pause with me and pray. This isn't a poem, it's a prayer. For those who love the whole, God, who loves every little bit of every little thing and every big thing, especially the ragged gaggle called public. Light our way with what both you and science see as sacred, blessed, honorable, worthy of sacrifice. Thank you for the amazing array of practices, behaviors, choices that lead to life, that protect it, enhance it, extend it, and spread its blessings widely across the people. Protect us, holding tight to any of us what you intend for the people. We see that you are not done because we can see that science is not done. Every day you reveal new possibilities worth doing together, even when some of us don't care about you and some of your followers don't care for the science that you have given us. Never let your public health servants stop talking about facts, analytics, determinants, vectors, pactors, predictors, but nurture most their crazy love for the people. The public, as you pull us to hope for better, hope for more and broader health, even with those with smaller hopes, take our money, put us in the dumpy offices and cut our staff. Even when those afraid of your vision treat us badly, never let us quit. Keep us as if in a lover's quarrel with the public we love, just as you so love. For those who serve the public who have lost their love for the public, please release them to less consequential work, not played for life and death. Move them gently but surely to some place where they will not endanger the work or your people. Give us delight in being part of those who just cannot stop loving your messy, disappointing, ever-muddling humans called the public. Thank you for placing us in just the right work at just this right time. We like the tools and facts and laptops as we know that your science is a friend of humans, a friend of us, and shows us how much mercy and justice is yet possible. But never let us speak of pride, only love. Love first, last, and in between, especially in public, especially with the public, especially about the people you so love. I'll end with the last slide. So the point, it's a Minnesota point. This should remind you of what it means to be a Minnesotan. It's not our little programs or clever messages over against death. It's the leading causes of life against death. And that's a fair fight. That's a fair fight, even on streets that are tougher than you'd think. I'll stop there. Thanks, Gene, Dawn, and the amazing people of Minnesota.
Bravo, Gary. You always kill it. Folks of us have been doing presentations with Gary Gunderson for about 5 or 6 years. And we learned real early, you don't ever want to follow Gary Gunderson. So let me just, I'll defer this to John Lewis. In closing, let's take back a couple of steps here. Yeah, three points to keep in mind. That community health, there's a question in here about, a couple of questions about polarization and so forth in our chat box already. And please be, after your amens, put your questions in because we got time and we're a lot of people here. So let's get to it. 3 takeaways. Community health has a vital role to play amid all this polarization, all this chaos. Community health cannot afford the luxury of contempt or condescension towards those in our communities who do not happen to share our viewpoints. And third, we must build the skill sets in our entire workforce, in our front line, as well as in our leaders, in order to change law and policy to meet these many new challenges. So you go out with the words of John Lewis, whose words echo. We're 3 weeks to the day after the insurrection on Capitol Hill that we all just flinched at. And I hear John Lewis saying, don't try to find the goodness in every human being. Don't ever give up on that other person. So that's all I got. I kick it back to, I want to thank Dawn and Gary for something really astonishing. And let's kick it back to Sarah, and you can advance the slides and get us going on the Q&As. We got our gloves and our cleats, and we're ready to go field them.
Thank you so much to our 3 presenters. It was a wonderful presentation. I learned a lot, actually, and I've heard some of you speak already. So if any of our attendees have a question, please enter them into the chat box, and please write your name and where you're from. Don, could you say the first question, please?
Yeah, so we have a couple of questions already in the chat box. So the first question is, how do you factor in the depth and power of conspiracy theories, fake news, QAnon, etc., that infuses our communities?
And that's my high school classmate, Carter Hayward, coming in. Good to hear from you, Carter, up in Brevard, North Carolina. Just a couple, Dawn covered a lot of this. You covered a lot of this in your presentation, Dawn. And I think part of it is some of the things we can't do, but some we can. And clearly that first quadrant that you showed in your slide about those that populate sort of both views, we have to target on that. So that's what this is about. I cannot control the polarization on the Potomac River. I give that the Serenity Prayer. But a couple of other things is you don't have to take the bait. You don't have to apply kind incline. Carter, you talk Christology about turning the other cheek as well as the anger of Christ. I think we've got to be careful about taking the bait of the extreme views of racism, the homophobia, the sexism, the discrimination against those with disabilities that just cuts right to our core, our harm value, our care value. Don't overreact, okay? And in response, drive away those that Dawn talked about as the curious, not the resistant. And we have the ability to do that, certainly on the political left. We are doing that. We have done it. And again, go to John Lewis. You never know when you get that unexpected validator. So I'll stop there. Gary?
So my comment would be, I've learned more about this from my mother and as a parent, as a grandparent, that people don't care what you know if they don't know that you care. And well, you can't tell them you care because that's one more word. They have to see it. They have to see it, not at the microphone. And so this was actually the big shift over the time we've been working on this better messaging, was actually a shift from messaging to messenger, to being a kind of a person who can find credibility because of their life across boundaries that you can't talk across. And God, I really wish there was some quicker way and better way. But that's the image of the fibroblast for me. It takes a whole congregation of fibroblasts to cross over those boundaries. And very frequently, you will simply not be the messenger who can communicate in any compelling or credible way to someone who may who you might think needs it the most. Someone else closer to them, more like them, maybe that messenger. So, I mean, this is the project of, our species ain't going to make it. We're not going to make it if we don't figure this out, if we don't become people who can be credible across boundaries that right now separate us. So there is no greater public health threat. There is no greater public health threat than our incapacity to talk.
The only thing I would add to that is that, I would avoid facts. Like we're not trying to change people's minds, and facts don't matter. And often all of us, no matter what we think, reject facts that conflict with our belief system. I mean, that's just kind of behavioral psychology. And so I'm going to post in the chat a link to an article that I think is really fascinating. It's called "The Role of Cognitive Dissonance in the Pandemic." And it really it kind of describes more of what Gary was just sharing with us in terms of how, the best messenger is often someone who has changed their behavior, who's like you and can talk to you, maybe, and thinking about engaging those folks. Go ahead.
I was going to say, John Lewis was what an extraordinary teacher over his decades. He began as a preacher, and I think he died as a preacher, and in between had decades of civil service. But he got arrested 40 some times. He'd had the crap beat out of him any number of times. And he did many things that were highly confrontive and provocative. He refused to go to the inauguration of Donald Trump. I had this thrown back at me when I was asking one of my conservative friends, well, why is he not honoring the inauguration of the guy I voted for? And he threw John Lewis right back in my face. So there is an element. These are life and death issues we're talking about: pandemic, climate, racism. These are all played for life and death. And of course, there's fire and friction at the heart of these issues. Somehow we have to learn how to be people who can go into the fire and friction, but not with animosity and not with hatefulness. And I think that's what John Lewis was always able to somehow be a human and recognize the humanity, even with people he was willing to be arrested to resist.
So I think this actually can build on what we're talking about. This is a question from Rosario, which is, how do you factor in people who don't belong to liberal or conservative groups labeled by default, but those who are free thinkers and don't fit into one of those boxes?
Yeah, and I apologize we compressed a lot of other content for this that we do in other training sessions, and there's a nice comment down from Mary P. about this. We do a lot of other types of training, and we're trying to figure out how to scale this up because it's so relevant in COVID. But and in Jonathan Haidt's book, the reference is in the chat box. He talks about this more, but the polarization that we're causing today even causes us to oversimplify between the libs and the conservatives, the blue and the red. And clearly the real world is much in between, just as Dawn, you pointed out in your 2x2 matrix, or the first quadrant. And so that's part of who we should be targeting, and again, not driving those into the arms of the demagogues and the manipulators. And I don't know, Gary, you've said something, maybe it was in one of your other prayers, about sort of the faith question that relates to this as well, about how do you deal with the ministers or those in the faith community that don't want to budge and parrot back the same responses to a different situation now?
Well, I think when I came to Wake Forest from Memphis to an academic medical center that was extremely proud of being an academic medical Medical Center, there was no small hesitation about talking about faith, even though it's the hospital at our core is a hospital called Baptist. There's great reluctance, and the attitude was to put faith in our history and to keep it part of our legacy, but not bring it into the present, and certainly don't project it into the future. And I actually sort of went right at that. And I said, the reason it's possible to have faith, must have faith in an academic medical center, certainly public health. Gene knows this was the same message. The CDC at the very dawn of the faith health movement was both faith and science believe that the most interesting things haven't happened yet. And some of us think that God's doing the creativity that is not stopped. And we're sort of curious, well, what's God going to do next? And science, especially, the whole essence of science is curiosity. And the basic discipline of science is to protect the not knowing that allows discovery to continue to happen. And so both faith and science are primarily designed to hold open and regard as sacred the possibility that we don't know something. So the not knowing is the most sacred thing there is in both science and faith. Well, we don't act like that. Normally when we come into dialogue, I'm trying to convince the scientists and the scientists trying to convince me. And so of course we don't get anywhere. And so I just think that's a basic thing. And we have to model that, not just say that. And so we have to be genuinely curious when we're in a faith setting about what God might do next. We have to be genuinely curious in a science setting. And, one of the hardest things for lay people to hear during the pandemic was when the scientists learned something new about the virus. Well, you lied to me. You didn't tell me the truth. Well, no, we learned something new. That's what scientists do. We're always learning something new. But it was regarded, because of the pride that they have experienced from us, when we learn something new and announce it as the new, it's regarded sort of like a betrayal. And well, I think we do that to ourselves by speaking with pride about what we already knew. Anyway, that's what I think.
I really appreciate that, because I think one of our failures in communication has been a failure to set expectations about our future communications in the course of the pandemic. I think if we had started out saying, what we know is going to change, and here's why, and here are the ways it might change, how might that have affected how people receive the message? We didn't set those expectations up front.
Well, the same thing goes if you look at most religious ritual of every possible faith, but certainly in my own Jewish Christian tradition, the heart of religious ritual is repentance, is lament, is the confession of our failure to hear what God already said and to do what God already told us to do. And you gotta do all that repentance stuff sort of to clear out the clutter so that you could go forward and do something new. So the repentance is never the end. It just sets the stage for what God might want you to do next. But very few of us faith people in public do much repentance in public. We act like we just don't do that. And so I think both science and faith could speak a great deal more about the humility that's at the core of our perspective, and speak a great deal less about how certain we are.
Well said. Well said. There are a lot of great comments in the chat, and I want to get to another question from Maria Vallejo, which is there a way to educate about the colonization and genocide that created these strong moral and political divides and involvement of government in the natural healing worlds?
Wow.
I mean, that's your structural racism piece, Dawn. You want to You go first on that.
Actually, when I first read this question, I was thinking about truth and reconciliation processes, and to Gary's point about repentance, which is taking ownership of the things that we have done to create social and structural barriers in communities. The first step is we have to say we did this wrong, and we affected people's lives as a result. And failing to acknowledge that, I think, makes it a continued barrier to making real meaningful change in community health. And so looking at processes that support that support bringing out the truth, support acknowledging the harms of the past, and incorporating that into our communities. There's a movement right now to incorporate it in higher education. Certainly probably space for that, and natural healing would be, I think, is an important first step.
Dawn, the heart of your teaching today was about storytelling and how critical it is to get the story right. And I think the human mind is wired for narrative, is wired for story, and the art is creating a space in which we slow down and don't leap to the punchline, but actually hear the narrative. And I think, certainly in my experience, it's extremely frustrating to slow down and hear the story of someone who, the end of their story is they disagree with you. Well, I want to go right to the fight. But when you hear the story, particularly long enough to actually hear the story of their parents and family and how they came to be, you got to hear the story probably more than one time to hear the different dimensions of it. That you don't argue with the story, you come into relationship with the story, and it's a little unpredictable how long that's going to take. But I'm convinced that's our fundamental challenge, is to cross over and be present in a non-judgmental way to others' oral stories. And I think that leads you right into the heart. The true story is not just choices you made as an autonomous, rational, choice-making individual. Very frequently, the story is filled with unanticipated pressures and tragedies that were not of your making. And so we call those things, we libs call them structural racism, intersectionality, this and that. But actually, it's the richness of a well-told, true narrative of a human life. And that takes time.
So another great question, and I think I love that there's ties between all these questions and the discussion that we're having, but it's how do we speak to the false analogy, of BIPOC and LGBTQ people who refuse to honor those who actively work against their basic human rights, and those who refuse to accept Biden because they disagree with him?
So it turns out that sex is a lot more complicated than we had been told.
Oh, please tell us, Gary.
Well, it's just a lot more complicated. And turns out to be a spectrum, not a choice, and not a binary. And oh my good God Almighty, but there is no more fraught point of friction with classic public health and sort of religious structures, because the reality is much of the complexity is not well served by formula and microphones. Again, the narrative is so much more complex and fraught. So.
Yeah, and it triggers again these questions so interrelate. Down near the bottom, Mary P. Jewison drops back in again, talking about how do I work as a public health nurse in dealing with absolutism of people's opinions. And we couldn't do it all in one session, but our other colleague on this here at UNC, Elizabeth Thomas, does this wonderful piece on active listening. And one of our other colleagues who's done plenaries with us here in North Carolina, Sue Lynn Ledford, who's conservative and a total devoted public health person and a great friend, illuminated me in doing advocacy for public health. And she's going out to the North Carolina General Assembly, and not all of the people around the North Carolina General Assembly are flaming blue liberals. There's a few conservatives up there. And part of her strategy is that listen piece right above that: listen, learn, and love. Listen, ask the question. Don't immediately respond with the soundbite that you've just pulled off MSNBC or off Fox News to respond. And ask the simple question: can you tell me more? Why do you feel that way? And it may not go anywhere, but it may. And, it kind of can open a door, and you can hear them talk about one of those 6 foundational values. And if you've done your homework, you know how to respond in that particular value. And you become a better messenger, and you're more authentic. So, the active listening is clearly part of it. But some you can't, Dawn. As you say, some are resistant and going to be resistant. And we can't do it all.
I was just remembering about 25 years ago, I was a seminary student, and I was vice chair of the deacons in a little Baptist church in Decatur, Georgia. And the first gay man presented for membership as a gay man. I'm sure we had.
I can pay for, and you just grab since you're coming this way,
Yeah.
but it probably won't.
But he was the first gay man who actually presented for membership. And the deacons, well, what are we going to do? Gary, research this and come back and tell us what we're supposed to do. Well, there were only 4 books at the time. I read all 4 of them and said, they don't help. And one of the elder deacons who'd been a member at the Baptist church for some 60 years said, well, Edith and I were not asked about sex when we joined the church. and we're not going to talk about it now. So I think we have to let them in, or everybody on the deacon board has to talk about their sexual practices and the sexual practices of their family. Anybody want to do that? And so we decided to let David in. But, there's some of these issues that you can't sort out. And if you make them the test of whether you can work together, you end up with a really small team because there are a lot of issues of contention. So some things we just have to say, let's have coffee and get to know each other. And in the meantime, let's work together on something we actually care about, pandemic. How about getting everybody vaccinated? So.
Dawn, we're at the top of the hour, but let's see if you can dig. You're tracking the chat box, and it's so rich, and I hope we share. But you got one more in there. I can't keep up with it.
There aren't more questions. There's lots of great comments. And one of those, Maria, in response to the conversation around storytelling as an Indigenous practice, I just wanted to share a resource, which I will put in the chat. It's called Reclaiming Native Truth. And it's an excellent resource about empowering communications around Indigenous communities that I think is a great resource. And I want to share it to build on that question, or build on Maria's point about storytelling as an Indigenous practice. There are also some other great resources that people have shared about community resilience. And let's see, no other questions. And we do have basically about 1 minute left. And so I would say, I don't know if we want to turn it over to Sarah for any closing comments. You're muted.
Oops.
There I am. Here I am. Well, thank you so much for everyone for attending, and Dawn, Jean, Gary, Christina, everyone for your presentations. This session has been recorded, so we'll be sending the recording link to all attendees, and including registrants who were unable to attend due to some capacity limits. But thank you so much. And I hope we can continue this conversation further. And if anyone has additional questions for the presenters, they've agreed to stay on for another 5-10 minutes for further discussion. So thank you.
If you put something in the chat, we will stay on and we'll answer those questions. But thank you to everyone for the rich discussion in the chat, for sure.
Yes, thank you for joining us. Bye for now.